Hello guys, so my name is Yancy Martínez and today I will be presenting to you my exercise video project for Kine's 3365-92L. Hope you'll enjoy. This video is a part of a class project. The information covered was collected with the sole purpose to expand our understanding of the effects of different exercises in the body. The information that will be discussed next is not a professional opinion, nor the technique should be taken seriously. What muscles and joints are involved? In this image, we can see the targeted muscles here include the gluteus maximus, rectus femoris, vastus lateralis, vastus medialis, and the oblique. The vastus intermedius, known as the quadriceps, being the agonist of the Olympic lift. In the image, we also have some of the synergists involved, like the bicep femoris, semitendinosus, semimembranous, and known as the hamstrings. The erector spinae, which are the muscles along the spine and back, as well as the adductor magnus, the inner thigh muscle, and the gastrocnemius. Some of the stabilizers which are not shown are the transverse abdominis, internal obliques, and the pelvic floor. Here we can see the joints being used, which will be the hips, knees, and ankles. These are the primary joints that happen to be used during a squat. The eccentric phase is caused by a hip flexion, knee flexion, and ankle dorsiflexion. During the concentric phase, a hip extension, knee extension, and ankle plantar flexion are used. Some of the benefits of this movement include stabilization of the core and strengthening, but also improves balance, easing pain in the lower back, and maintaining a good posture. It is considered a high-intensity compound movement which assists in the burning of calories. Also, boosting athletic ability and strength while adding a variation of squats or jump squats can help develop an explosive strength. Now a step-by-step performance. During this movement, you will begin the stance, feet approximately shoulder-width apart, toes pointing forward, aligned with the knees, over the second and third toes. To perform a high bar squat, you must have the barbell rest on the shoulders behind the neck with hands grasping the bar shoulder-width apart. Before we move on to this type of exercise, we will see the demonstration of a squat being done with no weight added or using the barbell to maintain a good posture throughout the exercise. Having an adequate shoulder mobility during this type of exercise is required. You may begin to slowly squat down by hinging down on the hips and flexing at the knees, allowing your glutes to stick out behind as if you were going to sit into a chair. Rising back up, one would contract the glutes and place pressure on the heels as the knees and hips are being extended. Standing up straight until the hips and legs are fully extended, fully contracting the glutes in standing upright position for maximal muscle recruitment. Here we will see the progression of a squat into a front squat. This creates a less stable environment for the client, which will use their core, activate their core for a more stable environment. Some of the common mistakes of a squat. A significant compensation would be knee valgus or knee displacement, also known as knock knees. This is a predictor of a knee injury such as an ACL injury. This is a combination of the femoral adduction and internal rotation of the tibia. Another mistake is having the feet turned out excessively. This is due to the fact that the individual might lack ankle mobility or limited ankle dorsiflexion, causing the individual to lean forward excessively. To avoid this type of movement, a cue or tip might be used as having their face facing to the ceiling or keeping their chest upright.